Hello, everyone. Thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the hospital's Department of Psychiatry, the hospital COPE team, and the University of Iowa Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller. Before we get started, I have some important information to share. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, dial 911 or go to your nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees, nor any contributor to this webinar makes any representations or warranties, express or implied, with respect to the information provided herein or to its use. Now on with our show. We're really excited that you joined us today for our program. There will be time for a limited number of questions at the end. If you're watching the live stream version of this program, questions may be submitted in the chat. Further resources will be available on the loop after we're done. Our presenter today is Dr. Kim Hart. She's a clinical associate professor of psychiatry. Dr. Hart is a clinician, a researcher, and an award-winning teacher in our department. The topic for today is radical acceptance. During her presentation, Dr. Hart will talk about the idea of radical acceptance and teach a strategy for grounding ourselves in moments of high stress. Here to tell you more without further ado is Dr. Hart.
Thank you, Dr. Fuller, and thanks so much for having me today. I'm really excited to have the opportunity to talk with you about how we might use strategies from dialectical behavior therapy to cope with challenges that life throws at us. And unfortunately, as we all know too well at this point, we face all kinds of painful circumstances in our lives, things that can shake us to our core, things that feel really unfair or unmanageable at times. And although we didn't cause the events and we don't have any choice in whether or not they showed up in our lives, we can learn strategies to more effectively respond to or even tolerate the pain that comes along with these events. So as humans, our natural instinct is to kind of try to avoid pain, either through solving our problems that are coming up or through getting rid of our painful feelings. And sometimes we do this using unhealthy coping strategies. This approach might work to some extent at times, and unfortunately, it also might lead to negative consequences in the long run. As humans, we kind of like certainty. We like things to be under our control, and when problems can't be solved, despite our best efforts, it's really frustrating and demoralizing. So the good news is that although we don't cause all the difficulties in our lives, and we might not have any choice over what shows up, we do have a choice about how to respond. So Dr. Marsha Linehan, who created dialectical behavior therapy, suggests that when it comes to facing challenges or problems in life, we really only have four choices. The first choice is to solve the problem. You can try to find a way to end it or change it, or maybe even kind of figure a way out of it for good. The second choice is to change how you feel about the problem. So maybe you can try to regulate your emotional response or potentially turn a negative into a positive. When you can't solve the problem and you can't feel better about it, you can still alleviate some distress by tolerating or accepting the problem and your reaction to it. And the fourth and final choice is to stay miserable or, unfortunately, even make things worse. And of course, I don't think any of us would be signing up for this option. It certainly doesn't sound very appealing. And yet, sometimes this is where we find ourselves. So right now, we're all dealing together with COVID-19 and the numerous changes, disruptions, the pain that it's causing. And in this pandemic, there are a lot of things we can't control or change. It's difficult to solve some of the problems. And we naturally feel fear, we feel anxiety, we might feel helpless, we might feel grief and sadness. And that makes it difficult to simply change how we feel about this. That seems kind of an unreasonable task. We can, however, through the skill of radical acceptance, learn to cope more effectively with the hand that we've been dealt. Radical acceptance is a skill for accepting reality, and it's a central part of Dr. Linehan's dialectical behavior therapy. So, what is radical acceptance exactly? Radical acceptance is when you stop fighting reality and stop protesting that reality isn't the way you want it to be, kind of letting go of bitterness. And the thing about this is you have to do it all the way, not just a little bit. You've got to do it with your mind, your heart, and your body. Sometimes I like to think about it as almost having a radical acceptance switch where it's either on or off, and maybe not so much like a dial that goes from 0 to 10. Now, I say all of this recognizing that sometimes the word acceptance itself brings up some strong or distressing thoughts and emotions for people, particularly the thought like, I don't want to accept this, or so you're just telling me that I should approve of this or condone this. Those are completely normal thoughts to be having. And I have some of those same thoughts. And the thing about radical acceptance is that it doesn't mean we're approving of what needs to be accepted. It doesn't mean we love it. It doesn't mean we're passive or resigned to it. Nor does it mean that we're against change. It just means that we acknowledge this is where we are right now. This is where we find ourselves. So oftentimes the questions come up. Well, what exactly do I need to accept? So there are 4 things. The first one is reality is as it is. The facts about the past and the present are the facts, even if we don't like them. Well, that's pretty tough. That's a hard thing to kind of incorporate into the way we live our lives. There are also some limitations on the future for everyone. And yet, we only need to accept realistic limitations. Everything has a cause, including events and situations that cause you pain and suffering. This isn't meant to suggest that someone or something is to blame. It's more of a process approach. So this thing led to this thing, led to that thing, led to this. This is the way that things happened. It's simply outlining how we got to this point. And then the fourth and final thing that needs to be accepted is that life can be worth living, even with painful events in it. This is really tough. And there is a way to find hope and meaning in life, even with pain, loss, and suffering. I think in a way, this really goes against everything that our minds tell us at times. And yet the data show that in the face of crises, people who are the most resilient are able to find meaning and appreciation in life, even in very small ways. So you might be asking yourself, what's the point of all of this? Why would I even try to go down this path? Well, the first reason is rejecting reality doesn't change it. We've probably all tried this in one way or another. I know I have. And the harder we fight or we try to kind of rebel against the way things are, oftentimes we just end up feeling really tired and demoralized. Another reason is that changing reality first requires that you accept reality. It's a little bit counterintuitive, but change and acceptance are flip sides of the same coin. Acceptance is not against change. It's not resignation. So when we resign ourselves to something, it means we just sort of passively withstand the pain. Acceptance is taking an active role. You can't change something until you first accept it. And if you don't accept it, you might be trying to change things that aren't really facts anyway. By fighting our reality, we're also not able to take any steps. So imagine that you are on the way to a job interview and you've never driven this route. It started raining, and on the way, of course, you get a flat tire. You sit in your car for 10 minutes protesting how unfair this is, how things shouldn't be this way. Totally understandable reaction. And this is the way things are. You can accept it and work on solving the problem. Maybe you get out and change your tire. Maybe you call AAA. Maybe you call the interviewer and say, hey, I'm running late due to a flat tire. Or you can continue to protest and stay stuck and maybe never get to the interview. Another reason is that pain can't be avoided. It's nature's way of telling us that something is wrong. So I think, if we could avoid pain, we probably would. And yet, if we did, we'd have really unfortunate consequences. So imagine if you didn't feel pain when you touch a hot stove. The pain of grief causes us to reach out to loved ones. Without pain, it would be more challenging to look after those of us who need care or who are sick and struggling. Another reason that we might want to try going down this path is that rejecting reality turns pain into suffering. So, pain is just pain, but when we add non acceptance, we get suffering. Accepting reality can also bring freedom. So, refusing to accept reality might keep you stuck in unhappiness and bitterness and anger or rage, shame. It might keep us from finding meaning. What if we drop the struggle? So, imagine that you're in a tug of war, that game that a lot of kids used to play, and you're in a tug of war with a monster. And the monster represents maybe a painful reality you don't want to accept, or maybe the emotions that you feel about that painful reality. And in between you and this monster is this pit of despair. And falling into it would probably be your demise. So this really is a life and death battle. And it feels like the harder you pull, the harder the monster pulls back. You're exhausted. You don't know what to do. But you have a couple of options. You can keep pulling and keep fighting reality, or you could drop the rope. Now, if you drop the rope, the monster isn't gone, right? There's the challenging part. But you are now free to move. You're free to engage in things and with people that really matter to you in this life. Another note about this is that acceptance is going to bring up some challenging emotions. Could be deep, deep sadness. And once you get through that, I think you'll find a sense of calm really follows. So, this is a process. I say all this as though it's this easy step by step process. And the simple fact is, it's much easier said than done for lots of reasons. So, I think many of us don't really know exactly how to do this, right? Sort of the nuts and bolts of it. And sometimes we fall back on this belief. Our minds kind of show up with, if I accept this thing, I'm approving of it, and nothing will be done to change future events. The other thing that happens is our emotions show up. So we might feel unbearable sadness or anxiety. We might feel anger at the person or the group that caused the painful event. Maybe rage at the injustice of the world, right? Like, why isn't more being done? Guilt about our own behavior, and so on. So these emotions can be really overwhelming and can prevent us from learning to acknowledge that this is the way things have happened and are right now. So Marsha Linehan is really, really brilliant in the way she laid out her skills manual, where you can find all of the steps toward reality acceptance. And she likes to present things in a very straightforward, kind of step-by-step way. So we'll go through the steps. But first, I want to note that I did struggle a little bit with whether or not this was a topic that I wanted to present, just because it does sometimes bring up really painful and distressing emotions. So, one of the things that I want to impart is yes, while this does need to be done completely, it may also be a process over time that gets paired with skills to reduce your distress along the way. So, before we kind of jump into the step by step of how to do radical acceptance, I just want to do a quick activity that allows us to make contact with the present moment and just sort of ground or center ourselves by bringing us back just to our five senses. We're going to keep our eyes open as we do this. So, if you've ever done mindful meditation, you may have closed your eyes, you may not have. Because we live our lives with our eyes open, the way to contact the present moment in this exercise is just to keep them open. So, the first step is really just to kind of take a breath. Just take a deep breath or a normal breath. And just bring your attention to your breathing and notice the parts of your body that move as you breathe. And then turn your attention back outside of your body and just notice five things that you can see in the room you're currently in. Just kind of look around the room and notice objects or colors. maybe the way things move or are still. And then turn your attention to four things that you can feel. This could be anything from the way your clothes feel against your skin, the sense of warmth or coolness on the back of your hand, maybe the texture of your clothes or even an object that you have handy in the room. And then turn your attention to three things you can hear. Maybe you can hear a ventilation system or the beeping of computers and monitors. Maybe you can hear birds chirping or the voices of people or your kids or my kids nearby. Maybe the hum of your computer or your belly rumbling for lunch or even just the sound of my voice right now. And then notice two things you can smell. You may need to take a brief walk to do this or notice something in the room that maybe would have a smell to it. Maybe soap, perfume, or nature. And then acknowledge one thing you can taste. That could be mint from a piece of gum, some coffee, your lunch, or maybe even just the taste of your tongue itself. And just conclude by taking a few more breaths and focusing your attention back on the activity at hand. And with practice, you can do this very quickly as a way to shift your focus and engage in what you're doing while also reducing your distress. So we've made contact with the present moment and we've reminded ourselves that we're in this moment. Let's talk about how to move toward radical acceptance step by step. So, in order to accept a deeply painful reality, we have to make the choice over and over and over to accept reality. So, as you kind of approach this, imagine that you're at a fork in the road, and one path leads toward continuing to reject reality, and one path is choosing to accept reality. And see if you can start kind of turn toward the acceptance path, noticing even that you're not accepting as you do that. Sometimes this shows up as thoughts like, I can't stand this, or it shouldn't be this way, this isn't fair. And in the spirit of being willing to take this step, make a commitment to accept reality over and over and over. And then try out these steps. The first one is observe that you're questioning or fighting reality. It shouldn't be this way. That could be a cue for you. Or I need to fix this right now. Remind yourself that the unpleasant reality is just as it is and cannot be changed. This is what happened. This is where we find ourselves. Remind yourself that there are causes for the reality. Acknowledge that some sort of history led up to this very moment and consider how people's lives have been shaped by a series of factors. So sometimes I like to think about this because it can be easy to sort of start assigning blame if we're not careful. But I don't know if anyone's ever had the experience of maybe running a little late to a meeting or running a little late to a planned activity. I know we'd never be late for work. So imagine you're in your car and you're looking at the time and you're thinking, yeah, kind of wish this car in front of me would get moving a little faster, or the light would change, or the train would hurry up. And the thing is that there were some things that happened maybe that morning. Maybe kids weren't cooperating. Maybe the car wasn't cooperating. Maybe your alarm didn't go off that led to this moment. And the same thing for everyone else who's in that moment with you, the car in front of you, right? A series of factors led every one of us to that specific moment at that time. And that's exactly how things should be. It's sort of a reminder that we're all connected and there's lots of causes, even if we can't pinpoint them in the moment. Practice accepting with the whole self. So, your mind and your body and your heart or your spirit, however you want to think about it. You could do this by trying out some relaxation or some mindfulness of your breath. You could also do this using some body strategies. Now, this is important because your face and your hands communicate with your brain. So, your mind and your body are connected. The first one I'm going to show you is called a half smile. So, the half smile is basically just slightly upturned lips with a relaxed face. If you're someone who has a little bit of difficulty kind of relaxing your face, you can try tensing all your muscles first, either kind of scrunching them up and then just kind of letting them go. You'll know it's a little bit more relaxed when your lips might be just a little bit apart, just a little bit. And then you're just going to let both corners of your mouth go slightly up. You may or may not notice somebody else doing that, and that's okay. If you could perceive me doing that, that's fine. If you couldn't, that's fine too. The most important thing is that you notice it. So, again, with a relaxed face, slightly upturned lips. Doesn't even have to look like a smile, and it's going to look different for everyone. The second strategy is called willing hands. And I'm going to kind of demonstrate here. I hope you can see this. Just sort of having relaxed fingers, thumbs a little bit out, palms up, kind of in an open, like, let me have this. Whatever it is, it's already here. Let me be open to it. So if you're sitting, you would just place your hands on your lap and with your palms, with your hands unclenched, turn your hands outward, like I showed you, palms up, fingers relaxed. You can do this standing or sitting down, or standing or lying down as well. The next step is sort of a rehearsal, almost like where you imagine believing what you don't want to accept. You rehearse in your mind what you might do if you did accept it, or a future version of yourself accepted this. You list the behaviors that you might do if you were to accept this. And then you act as though you already did. Now, sometimes the objection to this is it feels disingenuous, like I'm faking it. I think of this as an experiment. Let's see what happens, right? What happens if you act as if you already accept it? I don't know what's going to happen, but I think it's worth figuring that out. And then attend to your bodily sensations as you think about what you need to accept. Allow disappointment and sadness and grief to arise. And remind yourself that life can be worth living even when there is pain. And sometimes it can be helpful just to think about the pros and cons, right? What are the pros and cons of rejecting reality? What are the pros and cons of radically accepting reality? So I just want to reiterate that this is a skill. It takes time, it takes practice, it can be painful, and it's worth it. So as you try some of this out, as you take some of the steps toward radical acceptance, please also remember to show yourself some kindness. We're all going through a tough time right now. You are not alone in going through this. And there are many ways that we are all caring for ourselves, caring for each other, and remaining connected to the people and things that matter to us. So that's all I have for you today. Laura Fuller, thank you so much for inviting me to do this today, and be happy to take any questions.
Okay, well, there are a few questions for you. Thank you so much. I really, really appreciated that grounding 5, 4, 3, 2, 1 exercise. I really appreciated your point about that this is not easy, and that it can also be a very helpful thing for people to do in this time or at any really difficult time. So the first question for you is, when we are confronted with something that we really don't want to accept the reality of, and we want to figure out like how much to push or try and change it or rail against it. Like, what are some tips you have to help people figure out how much to rail against
Yeah.
something before moving to this?
My easy answer to that is it depends. It depends on the context. It depends on the person. I think Dr. Linehan says in her manual that when you can't keep painful events and emotions from coming your way, that's when to use this skill. Or when you find that you're living the life you don't want to be living, that's a time to use this skill. The if you've tried to solve a problem and you can't solve it, or maybe you find yourself kind of over and over and over saying, this isn't fair, this isn't fair, it shouldn't be this way. That might be a cue that radical acceptance could be something worth trying.
Wonderful. Thank you.
Mhm.
Um, Another question is, how do we show ourselves kindness? You mentioned it, and I wanted to know if you had some examples.
Sure. So, first of all, I think there will be some resources that will be put up about self compassion, which is sort of a nice term to think about in terms of self kindness. One of the first things that I would just suggest is acknowledging this is tough. Like, this is a painful moment that I'm in, and I'm not alone in it. Another way that I sometimes think about is just an exercise where maybe you take your hand, just either one of your hands, and sort of try to think of times where that hand did something kind. So maybe it was comforting a loved one, maybe it was caring for someone who was ill, maybe it was petting a dog or cradling a baby. Really anything that you can think of, giving something to someone who needed it. And then just noticing where the pain is that you're feeling in your body. If there's not a place, maybe just pick your heart, and just kind of put that hand with all that kindness over your heart and just kind of let it sit there and notice the warmth and see if you can turn some of that kindness toward yourself.
Awesome. So another question for you, Dr. Hart. Um, as people are trying to figure out how to manage their thoughts and feelings, one thing that can be important is also how we talk about things.
Mhm.
And we've talked about the idea of the and. Can you talk about maybe how someone can feel a certain way and also still act in a way that maybe they don't aren't enthused about acting?
Yeah, I think it's really, we can get sort of sucked into our thoughts really easily. And sometimes we get the message that we have to act on our thoughts just because they're there. And the other piece is that we can feel two ways about something. So it doesn't have to be a but. So, an example that I am very much deeply involved in right now is how much I love my kids. And they're driving me bananas, being off school for so long. So I can feel both of those things at the same time. And I can feel maybe sad that they're not in school right now and still choose to continue the things that matter to me as a parent, even though there may be some frustration there too. So it's kind of a both and versus a but perspective.
All right. Thank you very much. I think we are about at the end of our time. There are going to be some resources posted, and I wanted to say thank you so much, Dr. Hart. We appreciate you sharing some practical steps that we can all take during this coronavirus pandemic. A recording of today's live stream, as well as links to additional resources related to this topic, will be included in the loop later today. Next time, we'll be joined by Dr. Jamie Elizalde and Dr. Todd Kopelman, who will be discussing how to talk to and support your children during the time of coronavirus. Until then, take care, and we look forward to seeing you soon. Thank you.
Thank you, Dr. Fuller.